Why is it that you cannot accidentally connect oxygen to nitrous oxide, but you can give the wrong medication? Let's talk about it. Anesthesia machines are engineered for safety. Oxygen, nitrous oxide, and air are all color-coded, indexed, and physically impossible to misconnect. We use systems like the pin index safety system, which prevents attaching the wrong cylinder, and the diameter index safety system, which prevents connecting the wrong pipeline. You literally can't hook them up incorrectly. But medications, now these are different. I want to show you all several pictures. One, orange vial Versed and a blue vial Versed. Same medication, different color tops. Now, I'm going to show you this next image. Same Versed vials that I discussed previously. Now, these are different color variations of medication tops and medications themselves. All do different things. The real question is in a pinch, would you recognize the difference? We have Versed, which is a benzodiazepine used for sedation and amnesia. We have naloxone or Narcan, an opioid antagonist used to reverse respiratory depression. Zofran, used for nausea and vomiting. And glycopyrrolate, an anticholinergic used to increase heart rate and reduce secretions. These are all completely different classes of medication, completely different mechanisms of action, completely different clinical effects, and yet they all look the same. Same size, same shape, even the same color top. There is no pin system, no force connection, no safeguard, just a label and you. Now here's the important part. People are trying to fix this. Organizations like the ASTM and ISO have created standard color coding label systems for syringes. For an example, blue for opioids, orange for benzodiazepines, yellow for induction agents. But here's the problem. That standardization alone doesn't apply to manufacturer vials. So the vial you pick up may not follow any consistent color system at all. Groups like the Anesthesia Patient Safety Foundation and the Institute for Safe Medication Practices are pushing for better labeling, such as tall man lettering, drug names that are clearer, and higher contrast to prevent sound-alike, look-alike medication errors. We're also seeing more use of pre-filled syringes and barcode scanning systems, which helps reduce reliance on visual vigilance alone. But for right now, in real-world anesthesia practice, the final safety check is the human. In anesthesia, machines are engineered for safety, but medications rely on vigilance. The machine protects the patient from system mistakes, but you protect the patient from medication errors. Stay vigilant, my friends.